Hearing none, presentation of the 2016 Q3 business plans. I would turn it over to Kelly.
Thank you. Through you, Mr. Warden. What we're going to do this morning is give status updates in terms of where we are for the Q3 business plans. Given we have some labor contract negotiations in play, I'll ask, with your indulgence, the Director of HR to begin, and then we'll move from there to paramedic services, and then following that, return to normal order of the CAO. In terms of opening remarks, we are in the process right now of doing a full analysis of where we are with our KPIs. We're seeing some movement across the organization in a favorable way with KPIs. However, we really need to elevate to start to get them to be our real measuring stick in terms of how we're doing. For the benefit of the committee, I'll remind that we have a total of 90 special projects that we've been working on throughout 2016. And it's wonderful to be able to advise that the vast majority, approaching 93%, are on target and on budget. So that's always very reassuring. It's been a very busy year, but a very gratifying year on behalf of all of the directors. The financials so far, and I keep crossing anything I can cross in terms of winter control, but overall for the year of 2016, we are tracking very favorably to budget. And again, if the county engineer continues to work his magic in the next 6 to 8 weeks, we should return a good year. And last year, at the end of 2015, we did have some issues connected to staffing and wages that we do have under control, and we're looking to have a good year. So with that, Mr. Warden, I can turn it back to you for the Director of HR to begin.
Good, thank you. And I did forget to say welcome to those people that are visiting live stream this morning. So Human Resources up first. Good morning.
Good morning. Very pleased to be here to present the Q3 update for the Human Resources Department. So we are tracking well. If you look at our turnover rate, though, you'll see the one that really is jumping off as far as the KPI. We're having a high level of turnover, which is creating a lot of work in the HR department, making it a bit of a challenge to get through our other projects. So we're going to be putting a strategy together to see what we can do to get that number reduced, because we're well over where we should have been for the year. So we're basically at 140 job postings so far to date, with 3 recruiters working on that portfolio. We're a little higher on the full-time equivalent because that number still includes some of our summer staffing, so we'll see that come down in the Q4 report. And our OSHA recordables are a very favorable number for us to be reporting on. So although we've had a number of claims, they have not been severe. So they have not involved a lot of lost time and or medical aid. So to get that OSHA recordable number to 2.39 is a very favorable story. And of course, our unionized staff remain the same. In regards to major initiatives, we do have 3 members of the HR staff involved in training for cohorts number 3 and number 4. They won't graduate, but they'll be joining a couple of extra courses in cohort 5 that's going to start in January so that they can complete their graduation. Corporate succession plan is being enveloped into the new performance appraisal program. We have been through a number of gyrations and had selected a software provider. We, as you know, have decided not to use that software provider and use McDowell, which does not provide us a performance review form. So we'll be back looking at the development for that, along with the number 3, the performance appraisal system. The corporate training, we've had the new employee orientation roll out and continues to do well and flourish. The Avanti training program went live in Q1. The training matrix for health and safety has been developed, and it is now ready for upload into the HR downloads for rollout in 2017, so we're very excited about that. The 5-year strat plan has been reviewed both with the CAO and with the department heads, and currently working with corporate policy on the design of a standard format. Have been participating as a member of the Joint Steering Committee for the merger, or for the review of both the County of Bruce and Grey paramedic service, and it's anticipated there'll be another 4 to 8 months to get that completed. Under legislative compliance, we are obviously taking that very seriously. We want to make sure that we're always audit ready. And so we have gone through a payroll review that will be implemented shortly. And we have hired the consultant for the job evaluation, pay equity, and market review. That project was kicked off October the 6th, and the employee communications are all set for next Thursday and Friday. And we're targeting very well to get that completed early in 2017. As you know, we also undertook a mock health and safety review, and those results have been shared with the department heads, and we are now rolling out new policy around that. And we've also implemented some changes in our joint health and safety committees, and created some health and safety advisory committees as well. So we're tracking well with that. And we are also currently launching our ergonomic reviews. So I know that they're at a number of sites this week. Lockout takeout started last month and it's ongoing this year. And we're now launching out the hearing program as well into Q4. So tracking well.
Good. Okay, questions, comments? Milt?
Thank you. I'm just looking at your your head count, and I'm looking at an actual of 223 or 723 in 14, 713 in 15. These are actuals, and then we're jumping to 776. Is that what's going on, or what's?
Through you, Borden. That is a number that's going to have seasonal numbers in it right now. So we'll see that drop back down. So that's not permanent hires. That's a seasonal swing.
So when do you adjust those?
We'll see that result in Q4 because individuals on the contracts are paid 2 weeks after. So when we were picking up the Q3, we still had most of them on the payroll until they had their last record of employment issued.
And 17 and 18 is at 776. So.
And that's purely an estimate at this point, and we'll be able to hone in a little tighter on that when we finish this year.
So what seasonal adjustment do you expect on those numbers there?
We have a detailed headcount report that might be helpful, so you can go through, we can certainly provide that to the committee to go through and take a look at how it's broken down. Right now, as far as when we're looking at the 2017 budget, I don't have the number in front of me, but it was under 3 that we're looking at increasing overall, and that increase of 3 also included some seasonal positions like co-op students.
Okay, yeah, it just looks like a lot.
Through you, Mr. Warden, this is the Q3 update, so in an effort to try to show likeness with likeness, that when you see the 2017 projected in 18, it's as of Q3. So that to the director's point, you're going to see the seasonality, and when it comes back and you see it for December, that number will probably be back down closer to between 713 and 723, because then the seasonality will be complete.
Okay, good. Thank you.
Mike?
Thanks, Mr. Warden. I have a question around the major initiative number 6 there, where it's realignment of the services. And my question is around the $100,000 staff time. Is that a one-time cost that we're doing, or is that another person that we're going to have, or what makes up the $100,000 of staff time to reach this goal, I guess? Am I clear? You understand what I'm trying to say?
Through you, Board, and that was a combination of not just HR staff, but other staff, and it purely was an estimate. I don't think the actual will come anywhere close to that number.
So that'll be existing staff then?
That's correct.
Okay.
Through you, Mr. Warden, the one actual cost that's also in that number is the 50% of the consultant's fee for the report, which is $10,000, and the balance is absorption of staff time.
David?
Under item number 3, major initiatives, performance appraisals, is that, are we changing the way that we do individual appraisals under this new system, or is it just a way of tracking what we're already doing?
Through you, Board, we do have a number of different reviews across the organization. It starts off from about 3 different types of probationary reviews. We have a different review for the museum, the library, paramedic services, and I can continue on. So what we're trying to do is take all of those and merge them together, and we're trying to merge them along with some of our goals here at the county, and so we're looking at including more behavioral type review as along with health and safety. So we have been trialing a new one with the senior management team that's more reflective of the actual goals that we have, and we'll continue to do that. The software that we had initially selected with the job evaluation was also going to have a solution with it because Avante does not have a performance management module per se. All it does is capture the overall rating, but doesn't actually have a form. So we're going to continue to look at that to try to get that streamlined.
Okay, any other questions? Kelly?
Through you, Mr. Warden, more a comment that I wanted to reassure to the elected officials that when you look at the turnover rate, when Director Nero provides the detailed report, you're going to see that the big driver in that, which is very normal, but we're committed to getting it addressed, is in our long-term care facilities. It's a little bit of a revolving door, particularly for the personal support worker roles, that we're very committed to try to stabilize it because it is absorbing a vast amount of resources across the organization.
Thank you. Okay, thank you, Mary Ann. Good morning.
Good morning.
The floor is yours.
Thank you very much. Okay, for paramedic services, just going through our key performance indicators for Q3, approximately 78 responses per 1,000 population. If you extrapolate that out, we would projected runs in still 103, 104, so we're basically on track for the number of calls. Possibly that could come under because the summer calls have gone down a little bit. So in the last quarter, typically the call volume goes down a little bit. So we may not actually get up to 103 calls, but just for our own statistics. The next one we're still reporting on because this is part of this year's business plan, but you'll recall that we have changed this one for 2017. But the length of time for the dispatch center to receive the call and dispatch an ambulance takes approximately 1 minute 40 seconds for 90% of the calls. So, and their mandated timeline is under 2 minutes, so they're meeting that. So it's another number we'll track, but it's good to see that they're meeting their objectives as well. The next one, length of time for crew notification to arrival at scene for the highest priority. Those are our lights and sirens sort of calls. 90th percentile, 20 minutes, 33 seconds. So we are under the last couple of years. 2015 was 20 minutes, 53 seconds. 2014 was 20 minutes, 45. Again, it's only a few seconds difference, but we are a little bit lower. It'd be nice to project this forward to bring those down again. Cost for 1 hour ambulance service just remains consistent with this year's budget at $181. And for our CTAS response time, currently we're meeting 3 out of the 6 criteria. Those are in the CTAS 3, 4, and 5 categories. So a little bit less serious calls. We're making those on time. We're very close to the other ones, but not quite there yet. And compliance with the Emergency Management Ontario. As of today, we're still in conjunction with David Smith filing the paperwork, but after the exercise last week, we should be in compliance with meeting those requirements for this year. So I need to apologize here. I didn't update the column over here. It should be Q3 update, not Q2 update. But as far as the major initiatives, merging of paramedic services and long-term care, we're still on hold pending number 2. Paramedic services analysis between Grey and Bruce counties. The facilitator has been hired. They're currently working on their report for us. We're expecting those results sometime November. Ideally, they'll be done the first week in November, so we should have that report back. There'll still be work once that comes in, so we're expecting that to go into next year. So the merging of paramedic service long-term care goal will, as you know, has been moved also into the 2017 business plan. For reviewing our deployment plan, this is still ongoing. We're looking at the call volumes and locations. Now that summer is pretty much over, we're going to start being able to assess the summer call volume a little bit better and try and get a better report for you in Q4. Paramedic service strategic plan, again, on hold pending both basically number 1 and 2 initiatives. Updating emergency plans will happen in 2017. And same with the ambulance service review. We are starting to work on getting some of policies and things in straight. It doesn't happen until April of next year that we believe, but we're working already on that to get things ready for the review. And the replacement of 2 ambulances, not much of an update as far as they were sold back in July. And we did the report last week for you as to where they went. The gentleman actually came yesterday and started driving it to BC. So all our ambulances are gone. Hopefully he makes it there.
Good, thanks, Ray.
Okay.
Questions, comments? Janice?
Curious about the call time from when the dispatch and when the paramedics reach their destination. What do you do to try and reduce that time? I mean, other than making the commitment to put more ambulances on the road and personnel, how do you reduce that time? Is it just strategically placing the ambulances?
It's going to come down to doing something like that, yeah, figuring out where most of the calls happen and the busiest sort of times and trying to place them in those better. So looking at our deployment plan and trying to review everywhere. The program we have, the ministry one does pull some of that data, but our charting program really does help pull some of that out as to where the calls are and the time of day. So pulling those out and trying to figure that out a little bit, and then maybe we can place them in better locations during the busiest call times on a historical sort of thing. The ministry is aware of this. It's not just our issue. This is happening all over the province, so they are looking at ways of doing this too. again, it is the ministry and the province and how long it'll take them to upgrade their dispatching systems and how they can better integrate and help move vehicles around, but they are aware of it too. I wouldn't expect anything quickly from them, so it's something we need to work on as well.
So is there anything different that you're doing year after year? Because you're pretty close. Like it just seems like year after year, you're only seconds apart. So is there anything new and exciting, a new analysis that you can implement that's going to bring that down even more? Or?
We're hoping to by this year. We haven't done to be in all honesty, probably not done a great job in looking at where they've actually happened in the time of day in the past, other than trying to improve our times. Last August, we did move a vehicle in Port Elgin from a 9 to 5 shift and turned it to a 2 to 11 shift to help cover off some of those times in that area where it is a little bit busier, and that has helped a bit this year. I think we need to expand on that and look at a couple of the other vehicles that we have, and if we can change some of the times of day that they work or placing them better. Yeah.
I bet fresh eyes will help.
Mm-hmm.
Thank you.
Okay.
Other comments, questions? Thank you, sir.
Okay, thank you. Appreciate being able to go early so
Yep.
we can get back to negotiations.
Yeah.